Hello, everyone. So, as promised, I'm trying to just do a quick run through of the introductory notes. So, I do understand why it was a bit, it was a mouthful. Yes, there were a lot of parts put together. So, hopefully, this will help. And please listen to it because you did ask for it. So, anyway, our lab title, Parasite Quantification. So the first thing I mentioned was remember the diagnostic tools that you learned in Lab 1. That was the very first part. What are the tools that you're using to identify or confirm the presence of the pathogen? Okay, so we had the non-cultural and cultural, right? Okay, so whether it was under the non-cultural molecular immunodiagnostic tools, microscopy, or on the cultural side, these are all working together to identify your viruses, your bacterial infection, your parasitic infections. But of course, the limited lab here, we only appreciated microscopy and the immunodiagnostic tool, okay, the RDT, okay, the serology test there. So with that said, we learned about the tools. How are we using these tools now to quantify an infection? Because usually that would be the next question. Now that you know that there is a pathogen, so how much of it is present in the patient? So most of these tools that you know about are quantitative. They have a quantitative quality, but some of them you have to be careful. They have limitations, like the RDT that you learned about. It's limited. So it only has a qualitative quality. So you have to have that in mind as you familiarize yourself with these tools on the ground. So basically, what now our session is about is using microscopy, which has a quantitative quality, to appreciate, in our session, parasite quantification. But the whole topic is about quantifying pathogens. So please don't disregard the quantification of bacteria, the quantification of viruses. It's all important. So I've put in the leaflet there at the very end just a few notes to remind you about this. Okay, do not disregard quantification of bacteria, quantification of viruses, but for our learning purpose, we honed in on parasitic quantification, okay? Using microscopy as the tool, okay? So with that being said, our lab is divided into two parts, part A and part B. So I mentioned in the lab that part A was really the bulk of it. You actually had to do some microscopy and you have to do a practice at the end, part A, okay? But part B, the Hemeth overcount, basically just a run through of a procedure, a standard procedure that you'll come across when you see a report about an enteric parasite and it was graded. So that was just briefly a mention on part B, okay? But part A, that's the heart of it. Part A being an actual quantification of Plasmodium falciparum, okay, the parasitemia. Okay, so part A, the goal of it all, as you saw under task 3 and 4, is to practice an actual quantification with